Shalom. Welcome again to Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. I'm your host, Rabbi Richard Address. Thank you very, very much for joining us. We appreciate your time in what I hope to be a very, very interesting and educational conversation with our guests today. A note of logistics, if you'd like to contact us for about the show or ideas, please feel free to email me at rabbiaddress@jewishsacredaging.com. We are very, very pleased to welcome to today's edition of Seekers of Meaning, Dr. Daniel Water, a New Jersey-based psychologist now living in Florida, a recognized marriage and family therapist, and an internationally recognized sex therapy expert dealing specifically for our purposes today with sexuality in older adults. A very, very interesting and perhaps somewhat controversial subject. So first of all, Dr. Wada, welcome to the Seekers of Meaning. It's very nice. You're joining us from Florida, correct?
Yes. Thank you, Rabbi. It's very nice to be here. And yeah, I am in Florida right now.
Well, thankfully, and just enjoy. It's going to be 80 and 90 degrees here in southern New Jersey this week. So all we need is the ocean. Who knows? This whole subject of sexuality in older adults, I thank you for your time. Full disclosure, we met at a conversation that I was doing for a congregation in Florida. The doctor was in the audience. We got to talking. He was telling me what he does. I said, well, this is something I would really like to have on the podcast, because there just seems to be so much misinformation, non-information, mythology, facts, myths, whatever about sexuality as we get older. And when you impact technology, things have obviously, let's say, somewhat changed. How has the view, doctor, of sexuality and aging changed, let's just say, in the process of your career?
It has changed a lot. There was a time not all that long ago, and I guess for some still today, when the idea of sex and aging seemed like an oxymoron, that they just don't go together. But, people are living longer. They are living healthier lives. They are taking better care of themselves. They are staying active longer. And so it's natural that the sexual lives of people would be extended from what may have been the case, years ago. I think sex has always been important, no matter how old we were, even though it may be different than when we were younger. But the idea of, touch and love and affection, these things have always been important. I think the difference today, though, is as we age and our functionality is generally better than it was a generation or two ago, people expect to have more active sex lives than may have been the case for our ancestors.
Have the boomers really been the driving force of this?
Yeah, I think so. I mean, that's kind of who our aging population is today. And, boomers grew up really sort of expecting a lot more out of life, a lot more of life's pleasures that should be afforded them. And sex is no different.
So those of us from my generation, you're younger than I am, but what we're living through is, I guess the easiest way to say, is a natural process of our bodies changing.
Yes.
You get to be in your 70s and your 80s, your body starts changing. There are things going on there that just in the natural process that are just part of getting older. It's not a pathology. It's not a disease. It's just things don't function as well. Things aren't the same. The libido changes.
Yes.
How do we begin to educate people that a lot of this stuff is the natural process of growing older? It's not bad. And how do we begin to educate the people to accept this new reality and move forward with it? Because that just seems to be, in conversations with a lot of contemporaries, a real challenge.
It is. And I think that's one of the biggest challenges that we face in psychology and sex therapy and sexual medicine. And not just from a functional standpoint, but from an existential standpoint as well. As I was saying before, as we're getting older these days, boomers in particular, have come to expect, that certain things will be extended in life. But there's no doubt about the fact that our bodies change. And that includes our genitals and how they function, our libido, as you said. And you make a very important point here, is that is not pathology. That is what's supposed to happen. That is the natural progression of things. The problem is that we live in a society that reinforces and prizes the functioning of youth and is very much afraid of age-related changes. I sometimes use the example, there are just well over $1 billion a year spent on cosmetic surgeries in the United States for men and women. And I have never met anybody who said, I think I'm going to go have some cosmetic surgery done so I can look older. We all want to look younger, right? Everybody wants to look younger. And interestingly, in the sexuality realm, and this, I think, presents a very interesting ethical challenge for us too, is that these days, there's so much, especially in terms of male sexual function, that's designed to help men maintain their ability to have erections like they did when they were younger. Everything from, something like a penile prosthesis to the much less invasive oral medications like Viagra and other medications like that. And on the one hand, that's a wonderful thing. That we can give people these options. They have these alternatives. We can maybe make their bodies function differently. But there is an ethical issue here, which is, are we really helping people by reinforcing the sexuality of youth while we are getting older? Wouldn't it be better in some ways for us to educate people, as you say, about the normal changes that are supposed to happen and to develop an appreciation for a sexuality that's more consistent with the stage of life that we are at naturally? Because eventually that's where we're all going to get anyway. At some point, we can forestall it, but our bodies are going to change, no matter what. And so one of the things that I do think about a lot is, these sort of changes or advances in medical technology in a psychological, existential sense. Do we end up sort of colluding in this denial of the aging process, a denial of death? And at the end of the line, are people then less well prepared to be able to manage this reality than if we had sort of naturally helped them along as our bodies naturally change?
So are you aware of any curriculums in medical schools or any place else that tries to teach this idea of your body is changing? How do we accept the natural changes and what it means existentially, psychologically, even, and especially spiritually? Are you aware of any of those curriculum or classes?
Well, certainly that's characteristic of a lot of the lectures and trainings that I give, but as a curriculum per se, not really.
So if somebody wants to learn this, your book, have you written this?
Yes, this is a philosophy that is embedded in my book. I've written book chapters for other people's books where we've talked about this, but it is a hard sell. People
Sure.
people are afraid of aging. They are afraid. And what happens is as our bodies change, especially as our genitals change, oftentimes people feel that they are weakening, that they are losing vitality. They are losing what makes them feel strong. And which, the other side of that is it reminds them that we are progressing through life, and the ultimate is that we will die, at some point. And I think that in some ways, again, existentially, the idea that we want to preserve the sexual functioning of youth is a bit of a hedge against the recognition that at some point our existence will end.
So I'm a big fan. I think we mentioned this when we spoke before of Irving Yalom.
Yes.
He has a quote that sex is really a way to mollify the terror of death, because he's a big believer in death anxiety. And
absolutely.
So from what I'm hearing you say is this mythology of you have to remain sexually active, and I think it is a mythology the way you're explaining it, is really some sort of subconscious hedge against death and dying.
Yes. So Irving Yalom's work is, I think, It's terrific. I may have mentioned this to you when we spoke last. I trained with him years ago. And the book that I wrote is really about applying his theories to the practice of sex therapy.
What's the name of the book? Just in case somebody's like right there going to the Barnes and Noble or Amazon. What's the name of the book?
So the name of the book is The Existential Importance of the Penis, A Guide to Understanding Male Sexuality. And it really talks...
Have you pitched that to Netflix or the movie?
No, I haven't yet, although it might be an interesting one.
That's a great title. What's the existential what?
The Existential Importance of the Penis, A Guide to Understanding Male Sexuality. And it's really, it's about recognizing why the penis is so important to men and why they will go to such great lengths if they're having erection problems. I mean, even younger men, if they're having erection problems, they will put needles, direct injections into the penis. They will put urethral suppositories into the penis. They will use these vacuum devices that draw blood into the penis, all of which can be very, uncomfortable. Even things like Viagra, which are, very effective in many cases, non-invasive, but still have side effects that can be unpleasant. And one of the reasons I wrote the book I wrote is because what's not often well known is that each of these interventions, whether they are successful or not, the dropout rate from these treatments is extraordinarily high.
But what do you mean by dropout rate?
So Viagra, which is, what a huge seller. Cialis, Viagra, Levitra, all those drugs. The refill rate is less than 50%. Less than 50% of the people who get one of these prescriptions ever refill it.
And the reason is?
I think there are many reasons. One is sometimes they have partners who are not on board, for one. It can be very disruptive, especially since, for heterosexual couples in particular, we forget that you can have erect penises, but you still have aging vaginas, which, the tissue inside the vagina can be very brittle. It can be very dry. Intercourse becomes increasingly painful for many women. And so they're not really interested in having penetrative sex. They may be very interested in having non-penetrative sex, but penetrative sex can be very, very problematic. I think that's part of it. And I also think that what you were saying before and what Irv Yalom talks about as well is that it doesn't address the existential piece that my body is changing and I am getting older. There's a psychologist at Johns Hopkins University, Kay Redfield Jamison, who has written some very interesting books, but her most recent book called Fires in the Dark, she talks about what it is that's actually healing, what heals in medicine and in psychology. And she has a quote in there that I just love. She says, to treat and even to cure is not necessarily the same as to heal. And it's a perfect example here when we're talking about sexuality. And you can treat erection problems as an example, and you can cure them in a sense. It may be through some assisted device, but does that really heal the distress of the people who are taking advantage of these things? So you mentioned how, Irv Yalom talks about sex as a hedge against death. And he writes in his books, and I've written extensively in mine, about many cases that he and I have both seen of people when they had a confrontation with mortality, how they turned to sex unconsciously as a response to this. Probably the most poignant example of this that I have ever seen comes from, I'm sure most of your listeners and people tuning in are familiar with Elie Wiesel's book Night, right? And in the book Night, where he's writing about being on the train to Auschwitz, and he talks about people being packed into the train, They knew where they were going. They knew what awaited them at the end of the line. Yet he says, looking around, many people were having sex on the train to Auschwitz. It's not because they were sexually aroused. It's because this is what happens many times when we have confrontations with mortality. Sex is considered a life force. And so it's a life force that in some ways assuages the terror of death for those people who are terrified of death. Not everybody is, of course. And so a lot of the men that we see with erection problems, especially as they are aging, the changes in their body are a type of a confrontation with their own mortality. And so they will often go to great lengths to try and create some hedge against that.
Yeah, I find it fascinating that this linkage, and as you were talking, the existential issues around sexuality and the attempt to neutralize perhaps the reality of our own mortality just doesn't get talked about enough in the popular realm. You mentioned a couple of things also in that I just want to poke a little bit about female sexuality and the difference between men and women as we age. I'm sure you've done research and written about it. Is there a significant difference in the way women will view sexuality and sex as opposed to men as we get into our 80s?
I wouldn't say it's necessarily a significant difference in how it's viewed, but the way technology is evolving, there becomes a significant difference in terms of how it becomes employed. So what I mean by that is that if men and women sort of progress along the aging spectrum naturally, what happens for both is that penetrative sex becomes more difficult. For women, as I said before, the vaginal tissues will often stiffen and become more brittle, and intercourse becomes more painful. And for men, as they age naturally, erections are going to be less firm. They're going to last for a shorter duration. They're going to be a little more difficult to achieve. And if this was just allowed to continue, men and women would be pretty much in the same place, where if they wanted to remain sexually active, that sex life would be a non-penetrative sex life that could be very enjoyable, whether it's, manual stimulation, oral stimulation, whatever, they'd both be on the same page. The problem is with medical science really advancing the options for maintaining penile erection much better than we've been able to come up with ways of improving the vaginal environment. There's been more of a disconnect with men wanting to have intercourse much later than many women are physically able to do that. And so that's created a lot of difficulties in a lot of the couples that I see trying to find a way to be mutually sexual and enjoy that. So that's probably the biggest difference I see. It's more of a technological one than true interest.
So enter American capitalism. So I have this theory. I'm a big believer in pop culture, and the news hour, the local news hour, okay, between, let's say, 6 and 7 or whatever, wherever you live.
Right.
I have noticed, purely non-scientific analysis, but I have noticed in the last, let's say, several years, an increase in television advertisements at this particular period of time in the day around vaginal dryness, shifts in attitudes, drugs for both men and women to promote, as you'd say, penetrative sex. Is this now, have the drug companies seized, wait a minute, the boomers are aging, we're living longer, there's a market here. Am I totally off track?
No, absolutely. There is a market here, and it's a market that that often wants to be sort of captured and exploited. The problem for women is there's a market, there's just no product. So There is there is some medication, oral medication for women now that is being promoted. It recently got FDA approved, and it's supposed to increase women's sex drive, which I understand that it can do, but it still doesn't address the difficulties with the vaginal environment. Now, women who take hormone replacement therapies tend to do better. The estrogens that they take seem to improve the vaginal lining somewhat, but a lot of people are reluctant to do that because there have been, some reports, some of which have been really debunked by now, but still, the concern exists about the connection between, these estrogens and cervical and ovarian cancers. There are lots of lubricants, but none of which are really that effective or that good. And so, I've spoken to women over the years who have gone from gynecologist to gynecologist to gynecologist to endocrinologist to endocrinologist to endocrinologist. You name it, urogynecologists, they've gone to physical therapists, they've done all kinds of things, but with some successes. But again, as they get older, those successes are less. And again, my point is it helpful to even do this? I know you also are very interested in ethics and medical ethics. And, one of the questions that's often put forth in medical ethics is, just because we can, does it mean we should?
It's good, right.
Right? So even if we could do this, does it help people, or does it just allow them to engage in a denial of the realities of aging and prepare themselves as they need to, for the ends of life?
No, again, it's fascinating that and again, I thank you for this conversation, that so much of this just goes back to the inability or reluctance to accept, it's Genesis 3, to accept one's own mortality and the reality of mortality. And we do live in a culture, which I want to ask you about in a minute, but I just want to remind people that we're speaking with Dr. Daniel Water, based in Florida, a marriage and family therapist, sex therapy expert, and author. If somebody wanted to connect with you, is there a website or something that they can go online for? What is that?
Yeah, of course. My email address is very simple. It's just Dr. Water, DrWatter at mac.com. But I am part of a group, private practice, and we have a website. It's Morris Psychological Group, and our website is www.morrispsych.com, MorrisPsych.com. And so you can contact me through the website as well.
I want to ask you a question that comes up in some of our conversations in Jewish sacred aging around this subject, and that is the issue of intimacy. Is there a time in your practice, in your conversation with your clients, where the concept of intimacy, just being, touching, holding, really supersedes any type of traditional, as you would say, penetrative sex? It's just,
yes.
And I love the word intimacy, because I think it means so much because you can be intimate with another person sometimes just by sitting in the same room with them, just being part of the conversation, especially as we age.
Yes, it is part of the conversation. It becomes a more important part of the conversation as we age, as sex changes for many. But it really should be part of the conversation a lot sooner than that, because, one of the more interesting research subjects that I've been more and more aware of lately is the data that we have about life satisfaction, life happiness, and longevity seem to put connection with others and intimate relationships at the top of the list of the most important factors that contribute to good health and longer life. And these days, this is probably a topic for another time, or maybe with another guest, but, technology once again has, I think, really interfered with our ability to be intimate with others to be close with others, to be connected with each others. And, it's particularly relevant for men because the data that we've seen coming out of the pandemic years is that women have done much better than men on almost every mental health measure that we have. And it's in large part because during the pandemic, women stayed connected to other women. They were really sort of the first to do the Zoom kinds of cocktails or meals, the social distance walking. They kept in touch with their friends. Men, once they stopped going into their offices to work, they tended to isolate. They tended to sit home and have very few connections with anyone except their spouse if they were with somebody. And as a result, men's depression levels, men's loneliness levels were much more significant than women. So the idea that men really need to understand the importance of intimacy and connection is huge, I think.
Yeah, we're starting to see a little bit of a shift in this, I think, in the last year or so, when at least in a lot of our work, because it's communal Zoom classes and stuff, more men, they're attempting to accept the redefinition of community in ways that may not have been real 4 or 5 years ago, certainly pre-pandemic.
Yes.
Because of this need to be connected. And yeah, all the statistics of this loneliness epidemic amongst men, and I think not only older men, but also middle-aged men, where I'm seeing
absolutely
increases in suicidal ideology. And it's just a real societal problem that just still remains under the radar.
In some ways, I think younger men are at a greater risk because what I've discovered, and completely by accident, this is just as a result of observation, is that a lot of men, as they get older and if they retire, and now with the advent of these 55 and over communities,
yeah,
not just in Florida, they've been down here for a long time, but they're all over. This has been a real boon to men who want to be a little more socially engaged because they don't have to do anything except show up, right? You can go to the pool, you can go to the clubhouse, you can go here, you can go there, and there are people there. There are people to have meals with.
People to have sex with.
People to have sex with, that's true.
No. I was doing a conference a couple of years ago at Arizona State, and they assigned me the topic of older adult sexuality. And in doing the research, found that in where this conference is, in Maricopa County and around the corner from you in the Villages, highest level of sexually transmitted diseases.
Yes.
Were in this, it I just read it, whoa, this blows out that image of the guys rocking and, the rocking chair, just they're rocking, but
that's exactly right.
Before we start running out of time, the juxtaposition of this new reality of older adult sexuality with the American society, which is still ageist. Could you comment on this about this sort of like different views of reality? America still is an ageist society. It still worships youth, but yet here you have, look, the American Jewish community right now, as we speak in 2026, over 50% of the American Jewish community, if you look at the statistics, are people over the age of 50. And we're aging at a more rapid rate. And yet these subjects that you're talking, we don't really want to talk about this too much, do we?
Well, it's interesting because it's not talked about a lot. You're absolutely right. It's not an easy conversation for people to have. It is something that people are interested in.
Yes.
And the idea about mortality and the difficulties accepting and dealing with mortality is something that so many people come up to me after the talk and tell me they really appreciate that being put on the table, that's something that they do want to talk about, that they wish they could talk about, but there's really no place to talk about it. And I understand, when we visit someone who is sick, when we visit someone who is ill, a very natural response to their expressing concerns that they're not going to get better or they're dying is to say, oh, no, don't think like that. Come on. You've got a lot left, think positive, et cetera. It's well intentioned, but we actually shut down those conversations that a lot of people need to have. And that's one of the reasons why people as they age are also still very likely to seek out psychotherapy. That's where they can talk about these things. And perhaps that's why I'm not sure what the trajectory looks like, but I would also imagine that as people get older, they may start returning to shul too. They may start talking to their rabbis more. And
yes, it has to do with community and the fear of dying. I'm convinced of it.
Yeah, it makes sense to me.
So, in conclusion, I hope maybe that you will be inspired to write the curriculum for synagogue conversations about sexuality, and because there really is a lot there. And it is Genesis 3, which is the biblical this introduces finite factuality, as a professor of mine once said. Dr. Water, the website for the group, www.morrispsych.com, correct?
Yes, that's right. Yes, that's correct.
Thank you very much, sir. This is fascinating.
Thank you.
They opened the door for a lot more conversation. So I look forward to reconnecting with you, and please give my regards to the community and where you're at and the rabbi there who's former student of mine. So you just take care, stay healthy, and
thank you.
Continued success.
Thank you. And
watch out for those groups down there in Florida.
I'll be careful.
Thank
you for having me, and thank you for giving me an opportunity to talk about this. Yeah,
this is great. Thank you very much. And
pleasure.
Good luck with the book. I hope you sell the movie rights. To all of you, thank you very, very much for joining us on today's edition of The Seekers of Meaning, the podcast TV arm of Jewish Sacred Aging. We very, very much appreciate your time. Please visit us at the website, jewishsacredaging.com. There's a very conveniently located donate button there. We appreciate that. If you'd like to become a sponsor of some of these podcasts, please, again, just email me at rabbiaddress@jewishsacredaging.com. We'll take it from there. Seekers of Meaning is produced at the Broadcast Center of Lubetkin Media Companies in Cherry Hill, New Jersey. And a big shout out to our producer, Steve Lubetkin. To all of you, thank you very much again for joining us. In the meantime, till we see each other again, stay safe, stay healthy, and be kind to one another. Shalom, Todah.